Let's discuss about an autoimmune disorder called as Guillain-Barre syndrome. This Guillain-Barre syndrome is an acute inflammatory demyelinating disease, and it is a autoimmune disorder mainly affecting the peripheral nerves. And this condition is most commonly seen in between 30 to 50 years of age, and this condition is of almost 4 types, that is acute motor axonal neuropathy, acute motor sensory axonal neuropathy, Miller-Fisher syndrome, and also acute inflammatory demyelinating polyneuropathy. And this condition also can occur in the chronic inflammatory demyelinating polyneuropathy, but here Guillain-Barre syndrome mainly pertains to the acute inflammatory demyelinating polyneuropathy. And here the main pathogenesis is that the autoantibodies are mainly produced against the myelin and for unknown antigen. We don't know the antigen present, but the autoantibodies are directed against the myelin sheath present on the nerves. And the autoantibodies which are implicated are the anti-GM1 autoantibodies. And let's look into the clinical features and also investigations which help in the diagnosis of the Guillain-Barre syndrome. And there are also, we found some triggering factors related to the Guillain-Barre syndrome. We also look into them. And the pathogenesis mainly involved in this condition is that the autoantibodies are produced are the anti-GM1 antibodies. These autoantibodies formed against the myelin present in the peripheral nerves due to some unknown antigen, as a result of which there will be destruction of the myelin, and which results in low conduction of the nerves. And let's see the clinical features seen in the patients of Guillain-Barre syndrome. These patients often give the history of hours to days, and also they experience rubbery legs, tingling and dysesthesia of lower limbs, ascending paralysis is seen, that is the lower limbs affected first, followed by the upper trunk and as well as upper part, head and neck. And this way there is ascending paralysis is seen. And we also, in the later stages, we also see the involvement of the 3rd and 7th, that is a facial nerve, cranial nerves involvement, and this involvement may be bilateral also. And the patient also experiences some autonomic manifestations like bowel and bladder problems. Investigations are the electromyography, nerve conduction studies, even the lumbar puncture. In case of lumbar puncture and getting the CSF analysis, we find albuminocytological dissociation. We have seen all the investigations, treatment modalities, and investigations and also the triggering factors which lead to the Guillain-Barre syndrome. And let's see the treatment plan that is available. And the treatment offered to the patients are the IV immunoglobulins and also plasmapheresis. And we found there is no role of steroids for the treatment of Guillain-Barre syndrome, but in case of a chronic inflammatory demyelinating polyneuropathy, steroids are used, but in case of acute inflammatory demyelinating polyneuropathy, steroids has got no role, and there is good response for the IV immunoglobulins and also plasmapheresis. And this is all about Guillain-Barre syndrome in brief, and thank you for watching.